Hi, I'm Bonnie Benjamin, and welcome to Shining Lights, where we look at the very best of the North Quabbin region. Today, our guests from the CHCFC is
Community Health Center of Franklin County.
Got that? Community Health Center of Franklin County. And we are so glad to have them here because they've just moved into our neighborhood. They haven't been there long, and I'm sure we're going to find out all about it. So welcome. First, Allison van der Velden, who is the Chief Executive Officer, and Jessica Calabrese from the Chief Operations Officer. Allison, tell us, what is a community health center?
Well, this is my absolute favorite question, so thank you for asking. Community health centers provide primary care to people who need it, and we do that on a nonprofit basis. So we are not-for-profit, we're partially grant funded, and we set up operations in places that have a healthcare provider shortage. And so we are designed to serve patients and populations in areas where it can be really hard to access healthcare. So the Community Health Center of Franklin County, we've got two main locations. The Orange Athol location, or North Quabbin area, is right where the Aubuchon Plaza used to be. It's now called Health Center Plaza.
Oh, Health Center Plaza.
Yeah.
All right.
Yes, it's been an official name change. And we have that entire area there, and within that plaza, we provide primary medical care, behavioral health care, we have dental care, and then we'll have some partner agencies moving into that plaza as well.
And I heard about that. It's not only the one building, but you have several offices.
Right.
And those offices are for dental and mental health. Is that?
Yep. So we have dental providers, and we have this beautiful brand new office for dental care. 10 treatment rooms, and it's really nice. It's a big expansion for us. And really nice brand new equipment too, so it's quite a treat for the people who work there. And that's on one side of the parking lot, and then in the other building, we've got the medical care. So we have, we've got physicians, nurse practitioners, nurses, and then we have some mental health and behavioral health care providers as well. So.
It sounds like there's going to be a lot going on, and you're in charge, or you're overseeing all of it.
Yep, that's right. So I'm the Chief Executive Officer for the whole health center and all of the operations, and we're divided up into several departments to provide all these different services. And part of what I do is build relationships with other organizations. What we're really excited about with our new location on New Athol Road is the ability, because we own this property. This is the first time that the health center has actually owned its own property. We now have the opportunity to create a center, a community center, where healthcare and social services can exist in a convenient location for folks who need it and who have been trying to access it. So so part of my role as the CEO is to build those relationships, and we'll have some nonprofit organizations partnering with us to be our neighbors in that site.
Now, you used to be on West River Street, is that correct?
That is correct. So we are the same health center that used to be at West River Street, and we've moved the entire operation and expanded it at the new address at 119 New Athol Road.
119 New Athol Road. We'll be tested on that. I better have it right.
I know everybody's going to call it the Aubuchon Plaza, but it is Health Center Plaza now.
Health Center Plaza. That'll take some practice for us. Now, why would it be so important for the Community Health Center to move in the Athol Orange area?
We wanted to find a location where it would be very convenient for folks. And the new site, we're really excited about it because it is an area that people go by. It's an area that people are in anyway, and it's hard enough to get to your appointments or to make an appointment. As a new patient, it can be really challenging. So convenience is a big piece of that. We wanted to be near the buses. We wanted to be in an area where there's parking and where there are other things happening, so that it would be really accessible for patients.
And that parking area is fabulous. I've seen it. I even drove around for a parking tour just to see what it was like. And so much better than West River Street.
Yeah, we're really excited about it. I think that you don't want to have to go too far out of your way to get your health care. It should just be part of your regular life. One of the big goals that we have when working with patients is to make it easy. You know, it shouldn't be one barrier after another, and it shouldn't feel like navigating a maze. And so having everything right there in the same spot goes a long way.
That you've explained it very well, but I've got more questions in the works. It's coming, but I'd like you to meet Jessica. Jessica, what do your responsibilities include at this new facility?
Well, I'm the operations officer, which means that I oversee general operations for medical, dental, and behavioral health. But it also encompasses patient services and expansion projects and compliance and facilities. So in terms of the Orange building, I'm basically functioning as our landlord there and managing the other tenants in the building. So when we bought that property, there are several other businesses in the long building. And some of those tenants have stayed, some are leaving, and we have some vacant suites. So we are working to fill those vacant suites with other businesses that are in the social services or healthcare field or somehow adjacent to the mission that we have, and can provide easy access for people who are coming. So I do that, and just general things like the maintenance of the building, the snow plow contracts, the landscaping, fixing, getting people to fix problems with the building.
And there's problems. Even with the newly remodeled, I'm sure there's problems.
Always, yes. You can ask the Orange Fire Department about how well our fire monitoring system worked in the very beginning.
Oh,
It's better now.
It's better now. But there were some kinks, and so that's a big part of my job too, just making sure that everything's running right and then the doors open and the lights go on and we can take care of patients.
that is the next question. Who are your patients? Who are the clients? Who are those that are going to seek you for medical attention first? Is that your question?
I would
Allison?
love to start answering this question by saying everybody,
Yeah.
anybody. The community health center is designed to be inclusive and to serve people who need care. Really, it's anybody who needs health care. We take a wide variety of insurance plans. We serve patients who don't have insurance. We help people get insurance if they need it. And we serve patients with all kinds of diseases, healthy patients. We serve patients with chronic disease, diabetes, substance use disorders, really anything, because we know that, that care just needs to be accessible. So yes, the answer is anyone can be our patient.
Anyone. And you're going to help if they speak another language?
We have language services, interpretation services. Maybe Jess can jump in on some of the things I'm going to forget about. Accessibility. We
Yeah.
provide transportation. Let's see. There's
So
a million.
transportation in what sense? I mean, if I am a senior and I am home and I don't have a car anymore,
You still need to go to the doctor, and see a healthcare provider. And so we have our patient services department can actually help arrange a ride for you to get to your appointments.
now does it only mean that you're going to come if you don't have any insurance, or you might have some insurance, you might have none, you may have plenty of insurance, and still you'd be welcome at the community health care facility?
One of the things I love to say is that we exist to serve patients who don't have access to care, and so patients who are uninsured or underinsured are a key, population for us. At the same time, we are your community's health center, and we serve the health of the whole community. And so if you are a person who doesn't have any insurance, you can get care. If you're a person with fancy insurance, the care that you get at the health center, because we're nonprofit, it actually, those insurance reimbursements will get reinvested back into your community to help make the whole foundation healthier.
That sounds wonderful.
So really, we're for everyone.
We're for everyone. I like that. I like that a lot. So if you said, well, I've been afraid to go to the doctor, but whatever this is, I know I need to go. How do I get started? I've been waiting too long. I know I've been waiting. I've been bad. I haven't kept up with my health.
There's no shame. There's no shame. We are not in the business of judging or making people feel bad for either decisions they've made or care they haven't gotten yet. We're just here to walk people through that. And the website's a great place to start, chcfc.org. There's a ton of information there. You can call the office.
That number?
413-325-8500. It'll bring you to our switchboard, and then all you have to do is say why you're calling, and they'll direct you.
Absolutely. Now, do you think it's very often when you don't get anyone on the phone or you have to leave a message?
You'll always get someone if we're open. We have an answering service, and depending why you're calling, if you're following up on something, you might get a call back from someone if you have a specific question. If you're looking to make an appointment and you call during office hours, you'll reach a switchboard who will tell you exactly where to go, and you'll just provide information and they'll tell you how to sign up, or you may reach an answering service and they will do the same exact thing. So you might get a different person, but you will always get an answer when you call.
And how long do you think that it would take for a real person to get back to me? 24, 48 hours? I mean, not counting Sundays when you're closed.
The person who answers the phone is a real person, which is why I'm having trouble answering that question. Yeah, you'll reach a real person. If you are calling with a question about your specific care, it could take until the next business day if it was not urgent.
Fast.
Yeah, pretty fast. We don't want to be withholding information from people. It's really important that we keep them moving through the process.
Jessica, tell me, why was it important for the community health care to come out into this area? Why was the expansion needed?
Well, one of the things that Allie didn't quite mention in our history is that the Community Health Center of Franklin County specifically started off in Turners Falls, Massachusetts, about 25 years ago, 1997. I don't know if I did that math right.
Close.
Yeah. So that was the hub for a long time. And the expansion that happened, 10 years or so after that, moved the medical into Greenfield. And Greenfield has always been thought of as sort of our primary site. And Orange, I think, opened in 2006. And it was always sort of thought of as like a smaller satellite site. So this particular move in Orange allowed us to almost double our capacity, and also represented like the investment that we have in this community because we purchased property. So we are not renting, we are not tenants, we are here to stay, and we are investing in the community. We revitalized a property that was long vacant, and we're moving in new businesses, and we're renovating the upstairs, hopefully add additional space. And community health centers, there's a lot of reasons why they're amazing, and it's not just for the healthcare that we provide, it's also for the employers that we are. We employ from the community, we provide a lot of opportunities for people to grow and develop. I myself, my personal history is that I was hired with no experience and no education as a receptionist, and I've worked my way through several different promotions, and I've been supported with my education through the community health center and training. So we're employers, and we're also economic engines for the area that we're in.
I love that, economic engines. I love that.
So this property really fits a lot of the components of our mission, and being able to revitalize old property, provide space for more business. It all contributes back to the community and the financial health of the town. And
exciting.
Yeah.
And it's not just Orange. It's Athol, it's Royalston, it's Peterson, it's
the entire North Quabbin area.
Yes.
And really, we see patients from all over. So yeah, it's really open for anyone.
And what about the dental practice? So, tell us about that, how it started, why is it included, and
So dental care, and I'll have to just share, I think this would be an appropriate moment to confess that I am a dentist by training, and Jess is a hygienist before we were health center leaders. So we're really passionate about dental care, and it drives me just wild. It drives me crazy that dental care isn't considered health care. Your teeth are in your mouth, and your mouth is in your face, and your face is part of your body. And there's a huge number of people suffering from dental pain, dental infection, cosmetic dental issues that are interfering with their quality of life, their ability to get a job, all kinds of things. There's a lot of shame around dental care that just doesn't need to be there because it's health care. And you know, we have a society, a system that doesn't really treat it like that. It separates it out by insurance. It separates it out in all these different ways. But it is healthcare.
Yes.
So oral healthcare is healthcare, and so we're really committed to that. There's a huge unmet need for dental providers in the region, and so we really see that, and we're striving to meet as much of that need as we can, so that folks don't have to suffer through oral health problems that they.
And the pain can be terrible.
It can be awful. Some of the worst pain people experience. Yeah.
Can be that. And what about the the mental health portion? That is growing and growing, but we're going to work on it.
Yeah, right now, I mean, there's a ton of research, and you hear it in the news that mental health is really suffering during the pandemic. But we had a pre-existing problem, not just in the region, but all throughout the country with just mental health suffering. And we have a rise in substance use disorders. We have what we call diseases of despair, and it's all interrelated, but that is also healthcare. Your mind and your brain and your soul, these are not separate from our bodies, and they also, there are healthcare providers who can actually assist. So we have a small behavioral health department, and we partner with Behavioral Health Network as well as CHD, who are two major behavioral health, mental health organizations in the region. And so we have a small department. We do brief therapy, and we connect folks to long-term therapy, as well as we have a lot of treatments for substance use disorders.
And I've heard more often of those mental health issues and facilities closing instead of opening. This sounds like a bright light, a shining light. I've seen it.
Yes.
So how can they make that first step if someone is listening today?
Yeah, anybody, and like I said, with oral health, mental health is healthcare also. It's all just healthcare, and we really strive to be welcoming, to be accessible, and so calling that same number, 413-325-8500, and reach out, and you will have that phone call answered by a kind person who can direct your call and help you make that next step.
If you go to our website as well at www.chcfc.org.
Slowly, one more time. They're copying this down. I can see it now.
www.chcfc.org. We have several places where you can contact us through email. There's registration forms that you can download and yourself if people have the ability to do that, or just contact us through the website or through phone.
And the phone, people that might need that's all they know.
And the phone works great. We have robust systems for handling phone calls. So yes, we'll keep giving the website and the phone number, and it doesn't matter, where you start. You'll be able to find us.
And that is the important thing, is that you realize that your health is up to you and a team of professionals. And your job is to start.
That's right, yeah.
There could be several different ways that people come to us. I mean, when you think of healthcare, you're thinking of primary medical care, or dental care, behavioral health. But something that's unique about the community health center model is that it's based on the idea that health encompasses so many more things than just your physicals or your teeth cleaning or your counseling session. it thinks about whether or not you have food, whether or not you have housing or safe housing. Can you heat your home? Can you cook? Do you have childcare? Are you able to work? Do you have transportation? Do you speak the language? Any barrier and every barrier you can think of, we are there to address all of those, because we understand that being healthy is more than taking medicines or exercising. It's your relationships with your family, it's your relationships with your community, it's your connectedness to your community and the food that you're eating and all of those things. So people might think of coming to us because they need a new doctor, but they might also think of coming to us because they don't know how to navigate the resources there are for food, or they just aren't going to the doctor because they didn't think they could get transportation there, or they've never had insurance and they don't think they can get it. But we have people who can walk you through how to apply for Mass Health or free care or a sliding fee scale. There's just so many things we do that people don't realize the full
help is out there.
Thing.
Help is there. And right now it's with the CHCFC. It is here at the healthcare.
Yep, Health Center Plaza.
Health Center Plaza.
Formerly known as Abishan Plaza. Yeah.
People around, you'll notice that more and more. I know.
It'll catch on.
It'll catch on.
Yeah. We're also, being a community health center, we talk a lot about breaking down those barriers and those sort of extra pieces of what it takes to be healthy, besides the taking your medicine or making your appointment. We also, really invested in connecting people outside of our organization, and we're at this new location at Health Center Plaza. We're really excited about our collaborations with other organizations. So we are going to be working closely with BHN, who I mentioned previously. And they're a great organization, and they're going to be providing on-site office-based addiction treatment. It's going to be just that much easier to meet this huge unmet need for folks who need methadone treatment for addiction, or patients who are being seen at BHN who need primary care. We're really crossing paths, working together to just help people be okay. That's the goal with healthcare, is we want people to live long lives and satisfying lives that, on their terms, that they feel good about. It's all about quality.
And I think you'll find the North Quabbin region is rich in active professionals, people and organizations that care and can work collaboratively in so many ways. I think you'll find all of those things. Our time is fleeting by, but through COVID, you have probably made some changes too. And what are the changes you've had to make? And are there any of them that, as you did, and you seem to make the move in the middle of things?
We sure did. Yeah, we did not do one thing at a time. We did it all last year. We made some changes clinically in our clinical space to make it safer with airflow and things like that. Some of our protocols are different. If you call and you have an appointment, we will ask if you have a cough, the same questions you get asked almost anywhere, just to make sure that we're keeping our providers and the other patients safe. So if you aren't feeling well, you'll still be seen. We're a healthcare facility.
Yes.
We just want to know ahead of time so that we can properly, address it and make sure everybody is safe. We do provide telehealth. We do it with phone calls and video, which can be more convenient for some people and
more stressful for others.
And more stressful for others, right? So
Yes.
we're in person as well, and we've provided vaccine clinics throughout the winter. And our staff is vaccinated as well, and our primary care team can provide COVID vaccines. Did I miss some things?
Oh, you pretty much covered
covered
it.
them?
Yeah.
So COVID has made some changes, even in the studio here. We have some changes that we've made, and they were we can go right back to COVID, and they were safety then. And it sounds like you two have made those progressive changes to say, we're not going to change this. It works, it keeps people safe, and that's what we're going to do. That we're going to stay right there. It's time to wrap up. We want you each to have some time, your own time, to say what you'd like to. Could I start with you, Jessica? And I'm going to start with you, and you're going to wrap up what you do and how important it is for this North Quabbin region to welcome the residents that do not have health care or are ready for a change in some way. What do you have to say that would encourage them to take that first step?
I guess the thing I would say is that it's very important to us to, we say this often, meet people where they are at. So as I mentioned before, whatever you need, whether you connect it to a doctor or not, we see a lot of things as contributing to whether or not you can live a healthy, fulfilling life. So just to remember that there's a lot of ways we can help, and we like to partner with our patients to, instead of tell them what they need, listen to what they're telling us they need and figure out how to help things. Sometimes we might want somebody to, as a healthcare provider, we might say you need to exercise, you need to eat like this, you need to, do this thing. But if you're struggling to put food on the table or pay a bill or something, we recognize that we have to start there. And we want to start by supporting people with whatever they need and build on that. And our doors are open to everybody, and we,
just make that call.
Yeah, make the call.
Thank you. Jessica, your one moment of wrap up.
I would just like to emphasize to everybody that the community health center is your health center. It's your community, and that's why we exist. We are a nonprofit, so we don't have shareholders. We have a board of directors that's made out of community members, and it is required by regulation to be at least 51% patients. So it really is, in all senses of the word, it is your community and your health center. And we pride ourselves on quality. We want to just provide the healthcare that patients actually need in a way that they can actually use it. And so we are different in that way from other healthcare providers. We are a little bit more expansive, a little bit more inclusive of everybody, and there is something for everybody. We're part of the community. So
Yay!
yeah. And we're here to stay with that new site.
And what is that telephone number again, and the website?
The website is www.chcfc.org, and the phone number is 413-325-8500.
Thank you. Nice job, Gold Star. Nice job. Thank you very much, and welcome to the North Quabbin region.
Well, thank you.
Thank you.
We've been here and we're here to stay.
Oh, nice. It has been my pleasure to have you with us today. Whether you were listening to Spectrum and you were listening to 1301 and 1302, or maybe you were listening on WVAO Radio 105.9 FM, you are listening to your media connection. Oh, are similar things for everybody. AOTV and CHCFC, our community health center, and your media connection for the North Quabbin. Thanks for watching Shining Lights, and if you have an idea for a shining light, just give us a call at 978-249-4470. Keep those lights shining. Bye-bye.